clogged TV.
Beyond the policy.
Yeah, welcome back to the KOKO Digest Morning Show. If you are just tuning in, this is the KOKO Digest Morning Show, and we're about to have our main discussion, and it is about understanding your kidneys, a guide to kidney disease. Don't forget, we are streaming live on Facebook and YouTube, so send in your questions, your comments, all your suggestions, and we'll read them. You can also send them to our WhatsApp number that will be displayed on your screens along the line. We also do phone-in, so you can also call us when it's time and ask your questions to our guest. So yes, my guest is a doctor from Kolebu Teaching Hospital, right? Yes, Kolebu. Pardon?
Princess Marie-Louise Children's Hospital.
Okay, sorry about that. So she's from Princess Marie-Louise Teaching Hospital, and she's in the person of Dr. Anan, and she's going to be teaching us about our kidneys, what we need to know, debunk some myths, and also to be able to live a healthier life. So, thank you so much for joining us, Dr. Anan.
Thank you for having me.
Yes. We said we want to understand our kidneys. So first of all, what are our kidneys? We know it's part of the body, but where are they located? We want to know all those basic things first and foremost.
All right. It would help if we had the picture of the kidney projected.
Okay,
so I have two pictures. One
producers will put that up soon.
And then one with details.
Okay.
But I'll start off talking about them. The kidney is a paired structure, right? That's it over there. The kidney is a paired structure, and it's found just in the abdomen, close to the backboard, so close to the back side of the abdomen. And it has various blood vessels running through them. It is bean shaped. It also has the main purpose of removal of urine or toxins and water from the body.
Okay.
So the kidney, as we see on the screen, has the outer part and then the inner aspects with all those things running through them, leading to the ureter. That is where the urine goes through.
Okay.
Yes. Then we have the second picture, which shows the details. It is the nephron. The nephron is the functional unit of the kidney. So that is what does all the work in the kidney, basically. Okay. And I won't go into details, but you'll find that it has blood vessels in there. There are tubes in there. And then there is that part of it that is called the glomerulus.
Okay.
So when you see the glomerulus, I don't know whether the picture is clear enough on your screens, but then you should see the location of the glomerulus in between the tubes. That is on the screen right now. And as we go along, I'll talk about it and then how it goes and affects our functions and the diseases affecting them.
As you've even described, there are various parts of the kidneys. Can you give us maybe the basics, what they do?
Okay. So first and foremost, we have the glomerulus, where the blood flow goes in there. The kidney receives blood from the abdominal aorta. The abdominal aorta is a big blood vessel. When the blood goes in there, there's the renal artery, which receives that blood. And then the blood goes into the filtration process. So there's a filtration process where some ions are removed, fluid is also removed, and then as it goes down the tubes, we have the removal of toxins as well. Okay. So as these are removed along the way, such that we have, for instance, the absorption of calcium, the absorption of sodium, removal of other toxins and drugs. There is the remainder of this whole fluid that is in there. So the blood is actually filtered. Then the fluid comes out through the collecting duct, which enters the ureter and connects to the bladder. Then it comes out through the urethra, and the urine flows out through that.
Okay,
Yes.
okay. So I read a little about it, and they said the kidney has about 7 functions for us. So I'll just read what I know or what I read. So filtration of our blood,
Yeah.
regulation of fluid and electrolytes balance, acid-base balance, blood pressure regulation, red blood cell production, detoxification, and vitamin D metabolism. So I want you to touch a little on the blood pressure regulation and detoxification, because these are things that I'm sure our viewers have heard more often than the others. So if you can touch a little bit on that for us, especially because of the detoxification, where we get people marketing all kinds of medications and drinks and drugs for us that they will detoxify our bodies.
All right. So with regards to the blood pressure regulation, the kidney produces what is known as the renin.
Okay.
Renin is a hormone, all right? When the renin is produced, it goes, there's what is known as the RAS system, renin, angiotensin, aldosterone system. That's quite a complex, a long name. But then basically what happens is that the body, when there's reduced blood pressure, it senses it. This renin gets produced. There are a series of events that occur, and then we have other hormones also coming into play. So at the end of the day, what happens is that the blood, there's a fluid absorption, so that if someone has a lot of fluid in the body system, we reduce the kidney functions in such a way that with the production of the renin, there is that absorption of the fluid back into the system, and it goes into circulation again.
Okay.
So that the individual wouldn't have hypertension, high blood pressure, resulting from fluid overload. Then with regards to the detoxification, I've mentioned that there are a series of tubes in the nephron system. So as the blood goes through the various arteries, the capillaries inside the kidney, there is that filtration process and the reabsorption aspect and excretory function of the kidney. So the kidney is doing the reabsorption, doing excretion, and is doing the synthesis, that is the production, such as the production of the renin. So as it goes through the tubules, the toxins, the drugs, the excessive things that the body doesn't need are taken up by the kidneys, and then they are taken out from the body through the urine production.
Okay.
Yes. So actually, not to say that the herbal products are completely bad. The challenge with herbal medication use, especially the ones that are not prescribed, is that there's no particular dosage that is put on them. So for instance, you go to a local practitioner. I'm not talking about the licensed health practitioners who are practicing herbal medicine. No, the local ones. You would ask them to give you some medication. They've given you the medication. The next time you go there, you tell them it works for me. You ask them to give you similar thing, and they actually haven't perhaps documented it. They don't know how much of what they gave you, and they don't even have the calculation to say that, okay, take 5 meals, 10 meals, or take such an amount at this time or on this day, before or after meals. And others add other things to it. So there's that drug interaction, and then it leads to kidney problems.
Okay. So let's go into some of the common kidney diseases, because renal failure seems to be something that is becoming very, very rampant in our day in Ghana here. So yes, if you can give us a few kidney diseases that tend to affect people here in Ghana as well.
Yeah, the commonest kidney disease is the chronic kidney disease. Some people will say chronic renal failure. So with regards to that, what happens is that it could be from a structural defect of the kidney or a systemic problem that then results in affectation of the kidney. What I mean by structural defects is that our kidneys are shaped in a certain way, like I showed you, and there is a purpose to how it goes about its work. But then if there's something like polycystic kidney disease, I have a picture of that can be displayed for us, where we have the kidney having various pockets in there. Then it means that the kidney is affected, the kidney is diseased. So you wouldn't have the kidney functioning as it's supposed to be. Okay, so that's a congenital problem. people are sometimes born with this
Okay.
disease, the kidney being affected that way. Other congenital problems include renal agenesis, where the kidney is not formed properly.
Okay.
Okay, so if the kidney is not formed properly, it means, or sometimes it's not there at all, then it means that one is going to function on one kidney, and there's going to be a lot of pressure
Yeah.
on that kidney. So
Okay.
with time, the kidney then begins to fail.
Okay.
Other things are the shape of the kidney. For instance, if the kidney is horse-shaped, then and not particularly bean shaped, and then it is
okay. So that's the polycystic.
Yes, so that's the polycystic kidney disease,
okay.
and that affects the kidney in its function. That's beside it is the normal
normal kidney.
So that can lead to the chronic kidney disease.
Okay.
Another thing that leads to chronic kidney disease are, like I mentioned, the systemic problems. So for instance, if someone has diabetes mellitus, the person is going to have the kidney affected.
Okay.
Yes, so because there's going to be a lot of load on the kidney. The kidney has to filter out a lot from the system.
The person's body, yeah.
Yes, because the sugar level is high.
Okay.
Some of the diabetic patients have high cholesterol levels. And when all of these are affected, it by and large affects the whole system, because the blood is going through systemic circulation and then it gets into the kidney. The kidney then has all that workload to do on it.
Okay.
So we also have hypertension. Hypertension leads also to kidney disease. It's a two-way thing.
Okay.
Kidney problems can lead to hypertension. Hypertension can lead to kidney problems.
Okay.
Then there are other systemic diseases like the systemic lupus erythematosus.
Okay. Before we get there, what are some of the symptoms of the chronic kidney disease? What should you look out for, and then rush to your local health practitioner about?
All right. So in mentioning the function of the kidney, we mentioned the one thing that wasn't mentioned as part of the functions you listed was that of erythropoietin production by the kidney. Erythropoietin helps in the formation of red blood cells. Red blood cells, blood related. So if the kidney is not able to produce the erythropoietin, it means that there won't be enough red blood cells and blood production is reduced. Okay. So one symptom is that of anemia. Okay. Some people who have chronic disease, they have anemia, and then therefore you will realize that they are often pale.
Okay.
Other people, because of the fact that we need to have the excessive fluid taken out of the system through urine, when the kidney is not functioning properly, they have what we call fluid overload.
Okay.
So there's a lot of fluid in the body, and therefore it traverses to other through the cells into the intestine.
Yeah.
So we have what we call edema, swelling of the feet,
yes.
swelling sometimes of the abdomen. Then sometimes they have the facial puffiness, swelling of the face as well. Aside that, when the fluid also traverses into the lungs, so they have difficulty in breathing.
Okay.
Yes. With that aspect, some people, you realize that they come down with heart failure. Okay, so that also is an affectation of them. Calcium is needed in the body. Vitamin D is the active form of vitamin D is produced by the kidney.
Yeah.
Yes. So if the vitamin D is not present and calcium is needed by vitamin D for absorption, if that happens, the person is going to have muscle twitches, because calcium is needed for the proper skeletal and muscular function. So muscle twitches are there. They even can have seizures. Yeah.
Okay. So we can have anemia.
Yes.
We can have the fluid retention, so swelling of some of your peripheral parts of your body, your feet, your face, and then we can have the muscle twitches. We have a question here, but yes, keep your questions coming in. The phone lines are also open, so you can call and ask your questions. Send your questions to our live stream on Facebook and YouTube, or to our WhatsApp numbers. So yes, let me read it. So someone says, please ask her if alcohol digests and the effect of alcohol on the kidney. So over to you.
All right. Alcohol is a toxin as well.
Okay.
So digestion has to do with the GI system, the gastrointestinal system. Okay, so that's with regards to the GI. When alcohol gets into the kidney, it's toxic. So it ends up affecting the tubules of the kidney, and therefore leads to the nephritis, and it's quite a big word. But then, yes, alcohol affects the tubules of the
Okay.
kidney, and at large the whole kidney and the body system as
Yeah,
well.
but you say alcohol is a toxin, but some people would say, everything in moderation. So of course the body may need a little bit of alcohol and all of that. They say when you take it in moderation, it's fine. Can you touch on that for us a little?
Well, what we say in medical practice is that there's no safe level of alcohol.
Okay.
So the percentages you see out there, 12%, etc. Yes, when it comes to us, so we'll calculate the percentage of alcohol in your system and how it's going to affect you, and put it side by side to the prognosis.
Okay.
However, there is no safe limits to alcohol.
Okay.
Yes, so the percentages don't really matter. The thing is that even if you take it in bits over time, it's going to affect you in the long run. So
Okay.
it's actually better to stay away from it.
Okay.
Yes.
So something like, okay, we know that yes, the whiskey, the hard liquor is yes, but something like wine, people will say, hey, our Lord Jesus, those times they used to drink wine and all of that. So is wine something that can also damage your kidneys in the long run?
Yes, it can. Yes, it can. You want to box me in the corner and talk about our communion wine?
Oh, communion wine is not alcoholic,
Well,
or
some
okay, some
yes.
churches, yes.
Yeah.
So with that, does it also fall under that category?
Very safe level of answering the question. There's no safe limit.
There's no safe
to
limit.
alcohol.
Okay. So we have another question here. Okay, we have a few actually. So this one says, good morning, Yara. Please, how can lifestyle choices impact kidney health and help prevent diseases, kidney diseases? Yes.
Okay. In regards to lifestyle choices, I'm looking at...
Okay, before you answer, they say we have a caller on the line.
Okay.
Hello, good morning. Your name and where you're calling from, please.
Hello, good morning. Please, my name is Albert. I'm calling from Madinka.
Okay, hi, Alberta. Please, your question.
Please, I want to know the causes of the kidney problems in children, because some of the causes are intake of alcohol and smoking, but children don't take in alcohol and they don't smoke. So what's the main cause?
Okay. So the cause of kidney disease in children.
All right. In children, one of the things that affect them is the congenital aspect.
Okay.
So like I mentioned, there's congenital kidney diseases, one of which I mentioned is the polycystic kidney disease, and then the renal agenesis, the horseshoe kidney, those of the sort. They also sometimes have, they sometimes are exposed to the diseases of their mother while they were in the womb.
Okay.
So if anyone has any health or systemic chronic disease in the course of the child's life, the child gets affected by some of these things.
Okay.
Aside that, it is also necessary to note that something like streptococcal diseases,
Okay.
they cause respiratory tract infections. I don't know how else to break it down. But then...
so I think I can help. So the streptococcal is those colds and things, right?
Yes.
Yeah, I remember.
Yes, you've done well. So yes, they also can cause... They can also, when the child's system is immunocompromised, the system is not well built, the child is basically sick, or the body system is not well developed. Yes, they are prone to these diseases, which in the long run affects the system, the kidneys.
Okay.
Yeah.
So yes, we have more questions. So let's go back to the first one that we read. How can lifestyle choices impact kidney health and help prevent disease?
Okay. So with regards to that, one of the things is diet.
Diet. Okay.
I mentioned that the kidney does excretion. One of the things that it excretes is protein.
Okay.
Now, that is excess. If one does excess intake of meat diet, especially red meat, yes, why are you guilty? Then the person is going to have that kind of problem.
We have a caller on the line again. Hello, good morning. Your name and where you're calling from, please.
Yes, my name is...
Hello.
My name is Owusu Benjamin.
Okay. Your question, please.
I'm calling from Accra.
Okay. Your question, please.
So, so how can smoking affect the kidney?
How can what?
Smoking affect the kidney.
Okay. How can smoking affect the kidneys?
It's similar to the drug intoxication.
Okay.
Yes, smoking contains various particles. It contains nicotine. It contains substances that are harmful to the health. It's drug. Cigarette smoking, or even particulate smoking, secondary exposure to smoke, not just the cigarette and tobacco, but even the smoke from the fireplaces.
Okay,
especially
fumes.
those who are
Okay.
exposed for a long time. There's particulate matter in it. Okay, so that when it gets into the bloodstream, the main organ that does the filtration is the kidney.
Okay.
So all of these particles get in there. They are deposited in the Bowman's capsule, the glomerulus.
Yeah.
We showed that earlier.
Yeah.
So that bit of it, if imagine a sieve, okay, the kidney is like a sieve. So if these particulate matter, the particles, okay, are within the sieve, whether chemical-wise or particulate, okay, if they're within that sieve, it means that that sieve is going to be blocked.
Okay.
And so the filtration aspect will not be well done. Then there are receptors on the tubules, as well as the general structure of the kidney as a whole. If the receptors are affected by the breakdown of these drug and toxins, then there's going to be excessive workload on the kidney, because it is trying to get rid of these toxins, trying to clean itself up, and then as time goes on, there's that blockade, so the kidney is not able to filter very well, and there's so much pressure on it, it spills.
Okay. We have another caller on the line. Hello, good morning. Your name and where you're calling from, please.
Yeah, my name is Emmanuel Passion.
Okay, hello, Emmanuel. Your question, please.
I'm calling from Dansoma.
Okay.
Yeah, I wanted to know what are the symptoms that you can maybe know if you're having a kidney problem, like something that might occur that a sign for you to know that you're having those kind of problems.
Okay. We've mentioned before some of them. I'll add up a few more.
Okay.
So if you realize that you are pale, pallor, if someone is looking at you, the person may see from the conjunctiva. That will be the eyes when you depress the eye. But aside that, you can also access pallor with your palms.
Okay.
So if you realize that your palms are getting white, okay, the color, the redness of your palms is reducing, then that is a sign of a chronic kidney disease. If you also realize that you're having easy fatigability, the little thing you do, you are tired, then you are likely having that's a symptom of the chronic kidney disease.
Okay.
If you also realize, for instance, I've done a lot of things regarding general. Let me go to the women aspect. If you are a woman and you are having menstrual challenges, your menstrual flow is not coming or is coming irregularly, it could be as a result of a chronic kidney disease.
Okay.
Yes. So aside that, we spoke of the muscle twitching as well. So there's something called restless leg syndrome. The person is there, then the person moves the leg. The person's legs are not, it's restless, if I should put it that way. You want to move it this way, you want to move it that way. Your legs are just restless.
Okay.
It's a symptom of the chronic kidney disease. And we've also spoken about the puffiness, the facial puffiness, the legs getting swollen and things of the sort. Breathlessness is another sign and symptom, yeah. Even hypertension, when your blood pressure goes high.
So we have another caller on the line. Hello, good morning. Your name and where you're calling from, please.
Hello, morning. My name is Bayo.
Okay. Your question, please.
My name is Pastor Bayo.
Okay. Hello, Pastor Bayo. Please, your question.
My question is has to do with the issue of hydration.
Okay.
Hydration as regards to kidney health.
Could you turn down the volume of your set, please?
And I really want to find out
It says he wants to find out.
The issue regarding hydration
Okay, hydration.
as it relates to kidney health, and
Okay.
also the issue pertaining to ensuring a good pH level of the body, because I know acidity
Okay.
affects the body and can activate other diseases or infections.
Okay.
So how does the pH level, maintaining a good pH level of the body, affect our kidney health?
Okay. Thank you.
Okay. All right. So if I heard the question correctly or loudly enough, he was asking about. He first asked about hydration. I think it's a 2-in-1 question.
Okay.
Hydration. Fluid intake, and then he also asked about
The balance,
pH
yeah.
balance.
So I think he was talking more about water, drinking more water to balance the pH levels of the body.
All right. So the kidneys, they function very well when there's enough fluid in the system. You mentioned that there's this fluid balance by the kidneys. If one takes little water, you are going to become oliguric. I'll explain. Oliguria means that reduction in the urine production.
Okay.
When your urine gets concentrated, that's why some people you urinate and it's so yellowish. By other times you urinate and it is amber.
Yes, yeah.
Amber more like a little amber is like amber light, close
Yeah.
to yellow, and then the clear colorless
Yes.
urine. Okay, so colorless means that there's enough fluid in the system. All right, so it's actually necessary. We often talk about drinking about 8 glasses of water. So if you are able to take up enough water into the system, you're actually helping the kidney. If you take less water, then it means that the kidney will have to be functioning on that level of water intake that you have put into the system. And if you to try and put it in simple terms, consider a concentrated drink as compared to a lighter drink.
Yes.
If the lighter drink is to go through a mesh, it will flow freely. But if the other one, the concentrated one, is thick, concentrated is thick, okay, and it's going through the mesh, it won't go as freely as the other one. So when you have enough fluid in your system, the kidney doesn't have so much pressure and too much work on it. So the kidney is healthy.
Okay.
Yes. With regards to the pH regulation, the kidney does absorption of bicarbonates. And then there's also part of the electrolytes in the system. We have sodium, there's potassium, there's the bicarbonates. Bicarbonate is basic.
Okay.
And then we have the hydrogen. Hydrogen is acidic.
Okay, so we will hold on to that. We have a caller again on the line. Yes, hello, good morning. Your name and where you're calling from, please.
My name is Izira. I'm calling from Tamale.
Okay. Your question, please.
Please, I have a question.
Okay.
Please, whenever I feel urinating, I feel like, if I feel like I'm going to urinate, I feel pains at my back.
Okay.
So I want to find out from the doctor what is the cause.
Okay. Thank you.
All right.
You're welcome.
So pain in the back due to urination, it could be a renal colic.
Okay.
Kidney stone formation. If someone is having in the filtration and absorption of the fluid that goes through the kidneys, if there is the accumulation of, let me say, the salts, okay, generalized, and minerals, they form kidney stones. Kidney stones I have a picture of that as well.
Okay, can we have the kidney stones image displayed for us, please?
When there's kidney stone formation, as the urine goes through.
Okay.
Yes, so those are kidney stones. They're not supposed to be that's the ureter over there. The brownish structure coming out
tube.
of the kidney. The kidney is the bigger reddish aspect. Now, if you have the kidney stones, the whitish substances in there, as you can see, that one in the in the outer part, the one coming down, the whitest one, that's one of the stones. It has dilated the ureter. It has made it a little bigger, so it is bulging out. Now that's going to cause you pain. Okay, because that's not the correct structure of the ureter. So as it is coming down, as the kidney stone is coming down, it's causing that bulging out. It's causing some what we call ischemia, reduction of blood supply, which will lead to, it's part of the inflammatory process will go on and it will lead to the pain. So it could be that, I'm not diagnosing here, I can't diagnose her over this short conversation. No. It could be that she's having a kidney stone. Okay. It could be also due to pyelonephritis. It could be due to a lot of things, but most commonly, and what I can easily guess is happening with her, is that of the kidney stone causing renal colic pain from that. Yeah.
Okay. Thank you so much. So let's go back to the pH balance. Then we come back to our questions. I just hope I'm able to keep up with your questions today. Yes. So we were talking about the pH balance for the hydration question.
Yeah. So I was talking about absorption of
bicarbonate.
Hydrogen. So bicarbonate, I mentioned, is basic or alkaline, and then hydrogen is acidic.
Okay.
So as the whole process is going on, there's that absorption and reabsorption, removal and then production of removal and then reabsorption of the bicarbonate. So the blood already would contain the bicarbonates. The body system is, as it goes through the kidney, it's going to absorb the bicarbonate back into the whole system.
Okay.
Okay. There's that regulation that goes on. So the system is able to sense how much acidity or alkalinity is in the system, and as the process goes on, the reabsorption goes on accordingly. So excess hydrogen, which is acidic, goes out through the kidney. So when you test, let's move on with that. I don't want to confuse people. Yeah, going into detail will be confusing. But then basically the reason why we have that pH regulation is due to the absorption and then the removal of bicarbonates and then hydrogen.
Okay. So the lady who feels pain when she urinates, what would you advise she does? Should she just go and get some over-the-counter meds, or she should visit the local medical facility ASAP?
She definitely has to visit the medical facility.
Okay.
Yes, because we'll do history taking examination before. She may have to do imaging and then we can diagnose her.
Okay. So please, my dear lady, please find your nearest hospital and seek medical assistance as soon as possible. I even have questions on my own, but now, okay, let me try and see if I can follow the order. Okay, so this one says, Yaira, please ask Doc that with the alcohol, can we manage with beer? Because I know some people who have been drinking beer for a long time, but they are still fit. They said there is no safe quantity, so please, beer, whiskey, wine, just cut it. If you can't cut it out, cut it down to the lowest degree. This one says, good morning. Please, between our usual morning coffee beverage and caffeine energy drinks, which one is safe for the kidney?
Hey, is any of them safe?
No.
Caffeine is caffeine. The coffee contains caffeine. So it's not safe.
It's not safe, even in, moderate quantities. Okay, we have another caller on the line. Hey. Hello, your name and where you're calling from, please.
Hello, my name is Shadrach.
Please, what's your question?
Please, I want to ask that too much intake of paracetamol or other medicine can cause kidney failure or any kidney problem.
Yeah, I think so.
Whether paracetamol affects the kidney.
Too much paracetamol, too much medication.
Oh yes, there are some medications that actually affect the kidney. One of the topmost, paracetamol we don't talk. I won't talk so much about. Yes, it can affect the kidney, but it does more with regards to the liver.
Okay.
The ones that affect the kidney more are the NSAIDs, non-steroidal anti-inflammatory drugs.
Yeah.
For instance, ibuprofen.
Please mention them so that they hear it. Ghanaians, we like self-medicating, so
any NSAID, example being ibuprofen. The name that you would hear on the market is brufen.
Yes.
Ibuprofen. It affects the kidneys a lot. So it's one of the medications that affects it. So it's just necessary that you don't need to self-medicate. So some people come to us in the hospital and they talk about having headache or some form of pain somewhere. If you give them the paracetamol, they feel like you haven't taken care of them enough. They feel like I could have gotten this over the counter. But then we are also concerned about your kidney health. And in managing pain, there's a stepwise ladder. So we start from the lowest to the strongest. So that we do the paracetamol first before we go on to the NSAIDs. And even with the NSAIDs, sometimes we add a PPI, a proton pump inhibitor, to help prevent other challenges that come with NSAIDs. Because NSAIDs they are necessary devils sometimes, but they have some side effects before we move on to other ones. So medication, we are kind of mindful, and if you have a medical problem, that's why when we are taking history, we ask if you have any chronic disease, so that we won't give you some of these other medications. Aside the ibuprofen, there are other medications that can affect the kidney. So it's necessary to mention it to the doctor so that we are mindful of those ones.
Okay. So this one says, good morning, Yaya. This is a very helpful program. Please ask the doctor if kidney disease can be treated. This is Frimpong from Tema, Community 5.
All right, so there's acute kidney disease or kidney injury. Some people say acute renal failure. And then there's the chronic kidney disease.
Okay.
And they come in stages.
Okay.
So depending on the stage, you have your management regimen. With regards to the acute kidney disease, there are 3 stages. I don't need to go there. The CKD, there are 5 stages, and I don't need to go there either. But then, with regards to the acute, the reason why I mentioned the acute stage is that, for instance, if someone has try to break down hemodynamic loss. If someone loses blood, a lot of blood at one point, maybe through an RTI, a road traffic accident, the kidney is going to more or less shut down because we mentioned fluid. Okay, hemostasis. Fluid. Okay, hydration. It's all encompasses fluid. Okay. So if a person loses so much blood, it means a lot of fluid is gone. So the kidney shuts down because it can't work properly. Now, with regards to that, we are able to manage the person by replacing the blood loss, and replacing the fluid. If it has to do with electrolyte imbalance, that is substances in the blood that are lost also, we are able to replace it with the drip that we give people If it has to do with the person being on some medications and it's affecting the person's kidney, we control that. Now, if the person's kidney disease is so that is with regards to the acute stages. With regards to the chronic ones, if it has to do with diabetes, mellitus, or hypertension, then we have to control those ones. And that's why it's necessary to do health screening, and a regular health checkup. So you're able to catch those ones early so that they don't affect your kidney. So you manage them aside, depending on the stage. Now, the one that is challenging is the end-stage renal failure, which is stage 5. In stage 5, with regards to that management, we either do dialysis or a kidney transplant. So we hear of, I think dialysis has become very popular. Has taken over the news now. So that's how we manage the kidney.
So we have 3 questions from Z. So before the callers came in, her question was about lifestyle choices impacting kidney health and then helping to prevent the disease. Now she's also asking, please help me ask her if there are any specific foods or supplements that enhance kidney detoxification. And then she's asking, can prescribed medications cause side effects that may contribute to kidney disease, and how can patients mitigate these risks while managing their treatment? So this is 3.
The last one already.
The medication one. So the foods and supplements, to enhance kidney detoxification.
You don't need to. That your detox is your fluid,
Okay.
your water intake,
Okay.
and your exercise and your dietary regulation. You don't need a particular detox, whether it is tea whatsoever, to help with that.
Yeah.
If you're able to maintain a healthy lifestyle, you wouldn't need some of these detox teas or supplements.
Okay.
Because truthfully, some of these detox teas, even they have, some of them are, they have their own effects. So there's something about medication, or generally, whether herbal, natural, or artificial. Whilst it is doing something good,
It
has
also
its own side
exactly.
effects.
Okay.
They may say it doesn't have side effect, but sometimes it's in the long term.
Okay.
And it depends on your body system.
Okay. So someone also says, are soft drink takers safe from kidney issues?
Soft drinks. Soft drinks contain, for many of them,
High levels of sugar.
High levels of sugar, and we've been hammering the fact that diabetes mellitus could lead to kidney diseases. So I know that people want to have a safe limit, and they want you to say maybe take one glass per week or so.
Yes.
But then it's all dependent on your lifestyle management. If you take a lot of soft drinks, you are going to give the kidney a lot of work to do, because it has to filter out all the glucose that are in there. And some of them have colorants, colors. Yes. All of that
in your body. Okay. So we have questions from our live stream. So this one says, how do I clean my, so this TA, he says, how do I clean my kidneys naturally?
I mentioned the hydration.
Yes, so hydration. Now, big family audience also says, please, Yaira, ask Doc, what are the symptoms of low kidney function? We've answered that. And this one says, what color is your pee if you have kidney disease?
All right, so there are two things. It could be reddish, meaning that there's hematuria. Hematuria is blood in the urine, basically. So what happens is that if the red blood cells are filtered through the kidney, which it's not supposed to be, but it's happening because the kidney has been affected. The sieve has been broken. Let me put it that way. The sieve has been broken, means that the kidney is affected. The red blood cells, instead of being filtered out, will be filtered through the urine. So the blood appears in the urine, and therefore the person will have the hematuria, blood in the urine, so it will appear reddish. Other people would have very concentrated urine, so it will look very yellowish, and that is reduced fluid in the body. Yes.
So this one says, I am Daniel from Koforidia. Please, my question is, how can we prevent kidney disease?
How can we prevent kidney disease?
Yes.
The basic part has to do with the dietary and lifestyle management. We've spoken about the foods to avoid. Avoid the excessive meat intake. Avoid avoid the NSAIDs. That is the drugs. And then also you have to ensure that you exercise. Your lipid levels, your cholesterol intake, that's fatty foods. It's necessary for you to avoid them. Or
cut them down. Yes.
I know avoiding is difficult for people. So cut them down as much as you can, because I mentioned the blood vessels, they'll get lined with the fats that you're taking. They make the blood vessels difficult to stretch and relax as they are supposed to be naturally, and it even goes down to the kidneys, because the kidneys has the blood vessels as well. So those are some of the things that you can do to promote your kidney health. And hydration. One more thing, please, let me mention proper management of UTI. Urinary tract infection.
Yes, I was coming to that later, so maybe we'll hold on to that. We have another question. This one says, is coconut water good for flushing off the kidney?
Coconut water is water.
Okay. But it has some taste. Does it make it? No. So it's just water still?
Not that it's... what I'm trying to say is that the fluid component is necessary for the kidney health. And it is nutritious. It has potassium as well, which is necessary for the whole vitality of the body system. So coconut water is awesome.
Yes. All right. So, yes, now let me ask my own questions. What is the relationship? So, the lady who called about the pain, I think I've heard something like that where if you have pain in your back just below the ribs, it is likely to have something to do with kidney issues. How true is that? Aside, she had the issue of the pain when she pees, but actual pain just behind there, they say, is it true or is it a myth? If you can touch on that, please.
All right, so it is true. It doesn't necessarily, when I say it is true, it doesn't mean that all pain at the back is from kidney disease. Because sometimes we have muscular pain, musculoskeletal pain. Sometimes people come to us and they have chest pain and they think it's their heart that's causing a problem. No. So just like that, if you have pain at your back, it could be a musculoskeletal. It's just on the muscle level.
Okay.
But then if, I've mentioned the fact that if someone has kidney stones, the person and the stones are moving down the ureter.
Okay.
The thing is that the stones are inside the kidney. So as they are formed and as they are moving out, bits by bits, then you could be having the pain.
Okay.
We also can talk of pyelonephritis as a cause of the pain. The pain, yes. Pyelonephritis is like a bacterial infection of the, let me say the urine. Okay, bacterial infection. So that if bacteria, the urine, when it's formed, is supposed to move out. But if for any reason it collects in there, as it collects, some bacteria tend to thrive in there, and it causes what we call the pyelonephritis.
Okay.
So one of the symptoms of the pyelonephritis is the groin pain.
Okay.
The pain around, we call it the loin.
Okay.
Is the pain around that side. Another thing is that as part of if for instance we were imaging your kidney, the person's kidney, we will realize that there's enlargement of the kidney, or of the tubes, okay, especially the one coming out, which we call hydronephrosis.
Okay.
Which is another symptom, okay, especially when we do our imaging, we're able to catch that. So that if the person, as the structure bloats out, becomes bigger, whether it's through human retention or it's a kidney stone that is causing it, or a structural deformity, because there's the kidney, that part of the kidney is assuming a structure bigger than what it's supposed to be. There's that what I mentioned earlier as ischemia. There's loss of blood supply there, and when there's loss of blood supply, there's less oxygen there. The cells there around that side begin to die off, and then it's a whole process of inflammation. So there's pain as part of it that comes as a result of
okay. We have another question here. He says, please, I'm a chronic coffee drinker. I started drinking coffee since 2013. I feel slight pain between my bladder and thigh. Has that got something to do with kidney disease? Or please go to the hospital. Bladder and his thigh, between his bladder.
I'm trying to figure out either bladder and thigh. I don't know if the person actually knows. Not to say that the person doesn't know where the bladder is, but to say the bladder. Bladder is
yeah. So I think he feels pain in that area, in the pelvic area.
Okay, well, I can't sit here and say that you have a kidney problem. Like I said, we do history taking. We ask what's going on, how it happened, when it started, all of those things. Then we go on to, for all you know, he doesn't have a kidney problem yet. But then it's necessary that if it is chronic
coffee drinker,
please cut it down.
Yes, go to the hospital.
Allow yourself to be hydrated. Get yourself restful sleep. Do your dietary lifestyle modification. Visit the hospital. It doesn't hurt. We'll just take some blood sample and run testing.
Okay, so Emilia Yamoko Anan says, I have heard that it is not a good sign to have very clear urine. It should at least have some color. How true is that?
Okay, so natural, should I say the acceptable kind of color for urine? The urine that when you go to the hospital and they when you go to the hospital and they ask you for a urine sample, we do what we call the urine routine examination. We look at the color of the urine, and then we do the biochemistries as well if it becomes necessary. we talk of amber-colored urine.
Okay.
And I think I've mentioned
Yeah.
it. So
It's light yellow.
Yeah, it's light yellow, just like
Okay.
amber light. So if you see that amber-colored urine, it's also fine, unless you're having a fluid overload where you are going to have. I don't know whether she's trying to talk of diabetes insipidus, where the person, I don't want to go in there, but in diabetes insipidus, the person will produce a lot of urine.
Okay.
And if there's a lot of fluid in the system. Okay, so when there's a lot of fluid in the system, of course,
It has to come out,
it's going
yes.
to come out, and it's going to be lighter, way lighter than we expect.
Okay.
But it doesn't mean that all light-colored urine or clear urine is bad, no.
Okay. So this one says, please help me ask here that how can individuals with a family history of kidney disease proactively protect their kidney health? Taking my questions from me.
How can the person protect
Yeah.
himself or herself from?
Because, there's a family history.
Okay, so it depends on what the person is supposed to find out or help us, the medical practitioners, identify what other comorbidities, other chronic health conditions that the family has. So, for instance, if there was diabetes or hypertension in the family,
It could lead
it
to,
could lead
okay.
to the kidney disease. So that the family is having a kidney problem because of their family history of diabetes and hypertension. So there's that history is necessary for us.
Okay.
And if there are sometimes genetic or familial causes of the kidney problems leading to structural problems.
Okay.
So if there's any structural problem in the family and this is handed down, then definitely the person is going to have that as well. So proactivity would require that you do screening for diabetes,
Okay.
screen for the
Hypertension.
There are few tests that we run. It's good to do some of these routine tests. If you are having such a challenge in your family, once every 6 months or once a year, so that you are doing a liver function test. The liver function test will also help us to know whether your albumin levels. Okay? So liver function test, and then I mentioned the BUE, blood urea electrolyte test. Where it's still blood test. It helps us to identify what's going on in the system. So those are some of the things. And then cholesterol, lipid levels. Yeah.
So big family audience also asks, does dialysis cure kidney disease?
Cure. This is heartbreaking. It's heartbreaking to say that when you are on dialysis, it means that you are at the stage that there's no turning back. There's no cure.
Okay. So unless maybe transplant?
Exactly. When you're at that stage, it means that your kidney disease is not cured until you have had the transplant. So it doesn't cure the kidney disease. It rather helps the body system, because dialysis is going to act like, the dialysis machine acts like the kidney itself, and that's the filtration and all the way that the kidney needs to do. But it's doing it because the kidney is diseased and can't handle that. And then it gives you back good products of the whole process. So it doesn't cure, it only helps keep the body in shape by doing the kidney work.
So what is the relationship between the liver and the kidney? Because I've also heard that the liver also does some filtration as well.
The liver and the kidney, they both do. So the liver does some synthesis. Okay, the kidney also does synthesis, production of hormones, production of other things. Then excretion as well. So hepatorenal syndrome. Hepato is liver.
Liver, yes.
Renal is kidney. Okay. So if there's a renal pathology, it's, unless you want me to do pathophysiology, that's going to be long and difficult. Okay. So they are related. We call something hepatorenal syndrome. When the liver is affected, it irreversibly affects the kidney too. When the kidney is affected, it's also affected, because the whole body system is linked. The blood vessels are linked one to the other. So when there's an affectation of one part, it's it adversely goes on and consequently goes on to
Okay.
affect the other.
Okay.
I really hope I can just leave it there because that's another
Okay, so the kidney stones, are they formed by the particles that the kidney is not able to, are they like calcified objects that's as you describe the kidney as a sieve, are the kidney stones formed by the particles that are not able to go through?
Yes, the minerals.
Okay.
The minerals. So the magnesium, the calcium, they all these minerals. For instance, if you have salt water, imagine you've mixed salt inside water. You wouldn't see it; it's clear.
Yes.
But once you put it under, you subject it to heat.
Yes. Then the salt calcifies.
Stays. So it's the same with the kidney.
Okay.
It's the minerals that are in there, the salts, the sodiums, the magnesium, the calcium. All those salts, they clump together with time, and then they form the stones. Yes.
Okay. So I know that an advanced form of a UTI is what we call the pyelonephritis. And there's also this whole, I don't know if it's a myth, I think I should have checked, but they say women's ureters are shorter. So the distance between the bladder and the kidney is shorter than with men. So that makes women more prone to urinary tract infections. Can you touch on that for us and how it's related to the kidneys?
All right. So it's more with regards to the shortness of the urethra.
Okay.
I don't know if
we have a picture of both.
I'll just go on with that. The bladder. The bladder connects to the urethra. So let me start from the kidney. You've shown the kidney already. The kidney connects to a tube, which came out where we saw the stones. Okay. So this tube runs all the way down. Okay. Along the abdominal walls, and then it enters into the pelvic area, okay, where we have the bladder. The bladder then connects to the urethra. The urethra in.
Okay, we have an image.
Thank you so much. So that's the kidney over there. You've seen the urethra. The urethra is the tube that comes from the kidney.
Okay.
Then it connects to the bladder. Then the bladder connects to that funnel, the end of the funnel.
Yeah.
The bladder is like the funnel. So the end of the funnel is the urethra. Now the urethra of a female is short.
Okay.
It's shorter than the man's own.
Okay.
So because the man's urethra is passing through the whole length of the penis.
Yeah.
And the penis is longer than the vagina, if I should put it that way.
Yeah.
I hope I'm making some sense.
Yes, please.
So the urethra of the man is passing through the whole length of the penis, but then the woman's own is just from the vagina. I'm trying to use simple terms.
Yes.
Right? I'm not supposed to say vagina. It's not vagina. It's the urethra. So, but then the perineal area.
Okay.
Where the vagina is located is the perineal area. Let me use it that way. So the perineal area to the bladder in the women is shorter.
Okay.
So my one of my lecturers say that women we are open. Okay, we are open. So when the infections, when one is exposed to an infection, it gets into the urethra, and then because the urethra of the woman is shorter, it's traveling into the bladder is very easy. Okay, when the whatever infection is going on, whether it's bacterial, fungal, whatsoever, when it gets into the bladder, the distance between that and the kidney can allow the bacteria to traverse through that whole length and affect the kidneys.
Okay.
However, in the men, the urethra has a longer way. I mean, the infectious agent has a longer way to travel, so they don't get easily affected.
So before we wrap up, does holding urine, because you're afraid the place is not sanitary, does holding urine till maybe you get home is it also a factor in infections or even pyelonephritis?
Oh yes. So let's have the picture again.
One last time, please.
All right. So this picture shows us a normal kidney and then a kidney with hydronephrosis. Hydronephrosis is kidney urine trapped in the kidney or urethra. So you can see that on. So the urine has traveled back up. Yes. So that urine has traveled back up, and it has caused the ureter to become bigger.
Okay.
So when you hold your urine for a long time, then you're actually forcing. So the urine is supposed to come out, but you're forcing the urine to stay in there. It's going to go back to sender.
Okay.
So it goes back up, and then it causes we call it hydronephrosis. It swells up, and then when bacterial infection colonization becomes more, then we have the pyelonephrosis.
Okay. So we definitely need to have a part 2 because there were so many questions that we did not get to ask. So we will definitely have you back. So before we wrap up, what are your closing remarks or warnings, that's strong warnings to our viewers in order to help them take care of their kidneys?
All right. So the kidney is a very important structure. It is a friendly structure. My renal lecturer, the renal consultant, she boasts that you can live on one kidney more than you can live on any paired organ, and say you're living on just one of that paired organ. The kidneys are very, very strong, and they can sustain you. But then, if you are able to take care of it by drinking enough water and managing your lifestyle choices, then you are able to have a good choice, a good chance of having a healthy kidney for a long time. However, some of these bad choices, like the NSAID abuse, use of unprescribed herbal medications, excessive protein intake, excessive cholesterol intake, would affect your kidney, and these things, which otherwise should have been prevented, will cost you a lot. Imagine going through dialysis or kidney transplant. So protect your kidney health, and then you would be protected.
Thank you very, very much. Please stay hydrated. Our doctor says hydration is the best way to detoxify your body. So if anyone comes to you telling you to drink something, eat something to detoxify your body, consult with the doctor first and foremost. But if you want to detoxify on your own, please use water, clean potable water, drink water, and just stay safe. Thank you so much, Dr. Annan. We will have to have you back here because we didn't even talk about sexual activities and even the state of our dialysis issues here in the country. We have to come back. So
Can I acknowledge one or two people?
Oh, sure, you are allowed.
I like to acknowledge Captain, I don't know if his title has changed, but he was Captain Amedo at the time that I was with him. He's at 37 Military Hospital. And then also I like to acknowledge Dr. Nyako. He's also at 37 Military Hospital. He's a renal specialist. I say a big thank you to them for all their guidance. Without them, I couldn't have made it to this point in my life and to talk about all these kidney diseases. I'd also like to say a big thank you to my family, especially my sister Amy Beth of That Touch. Yeah, she does fascinating bridal items, and she's been of great support when it comes to cheering me on in everything I do. And of course, my husband, Emmanuel Abaji Manomi, of Manomi Incorporated and Chip Shop. So thank you all, and thank you for the guidance you've given me and the opportunity to speak with your audience.
Thank you very, very much. We will definitely have you back. Someone quickly asked about marijuana. It is part. It is very much a part of this. It falls under the smoking. So please, just because she didn't mention it doesn't mean it is not part. It is very, very part. So yes, this brings us to the end of the KOKO Digest Morning Show. I hope you learned something, because we are here to educate, inform, and of course, entertain. Please, let's say a big thank you to our guests, a big thank you to you, my cherished viewers, a big thank you to our production and management teams, a big thank you to everybody, our sponsors, who made all of this a success. Do have a blessed weekend ahead. I'll see you again on Tuesday morning, bright and early, same time. Have a blessed day.
clogged TV. Beyond the policy.